This is the Denture Care, the dental care. What I've done already is I've knocked. I've entered the room, introduced myself, greeted the resident, explained the procedure that we're going to do. I've washed my hands, put on gloves, and I've got the resident raised so that I can perform the oral hygiene. I've got a towel draped over their chest. I've got my gauze in my hand. I've already got my gloves on. And to go ahead and remove the dentures, what I would do is the upper denture. This is if the resident cannot remove the dentures themselves, by grasping the teeth a little bit and then just kind of pulling down slightly, which will break the seal. Once I've done that, I will be placing the denture into a cup, denture cup. I will be removing the bottom denture by tilting it slightly to break the seal. So I've got the bottom denture, like placing it in the cup. And at this point, what I would do is I've got a sink already lined with a towel at the bottom, and I've got it filled halfway with water. While working there, what I would do is take the denture, one of the dentures, and rinse it off a little bit, and place it back in the cup. Take the second denture, do the same thing, rinse it with warm water, and place it back in the cup. The next step would be actually cleaning the dentures themselves. So while we'll assume this is the bottom denture and this is my toothbrush with the toothpaste on it already, what I'm going to be doing is cleaning all the chewing surfaces. So the front and both sides, the tops, and then for the inside front, I will be at a 45-degree angle, moving with upward brush strokes. I would go ahead and rinse that off and then place it back in the denture cup and then fill the denture cup with cool water. The same thing for the top denture, the toothpaste, cleaning all chewing surfaces, sides, bottom, front, and then for the front, back, at a 45-degree angle with upward strokes as well. I'll be rinsing and then placing it back in the cup and then filling the cup again with cool water. At this point, I would be going back, taking all this back to the resident and letting them clean out their mouth with mouthwash, and then giving them the dentures back, either helping them put them back in or letting them put them in themselves if they can't. If they can't, still using a gauze, placing them back into the lower dentures, putting in, pressing down a little bit to make sure the seal fits over the top, lifting up the lip, and putting the denture in, making sure that it fits as well. If they don't sleep in their dentures, or if they're keeping their dentures out, they would stay in the cup near the bed stand, close to the bed, within reach. If they don't sleep in them, they'll have them back in their mouth. At this point, we would make sure that the resident is comfortable, remove the sheet or remove the towel from their chest, have their signal light close to them, go ahead and remove my gloves, dispose of them, decontaminate my hands by washing them, and then record my observations.